I'm Ramona and welcome to Ramona Interviews. And with me in the chair today is Dr. Jennifer Lish. Welcome, Jennifer.
Thank you.
Just introduce yourself briefly and then let's get into those examples.
Okay, I'm Dr. Jennifer Lish. I'm from the Worcester Center for Cognitive Behavior Therapy, which is at 9 Cedar Street in Worcester. And we specialize in the treatment of psychiatric illnesses, emotional disorders with cognitive behavior therapy.
And what's your website?
It's www.worcestercognitivebehaviortherapy.com.
Let's dive into those examples.
Okay.
What's our first example today?
Okay, well, I saw a teenager, we'll call him Joe. He was expecting not to be able to go away to college. It was time for him to apply to college, and he had Classic Contamination OCD. Concern about dirt and germs and mess and muck, to the extent that it was inconceivable to him and his parents that this child would go live in a dormitory. Not a child, he was 18. So it was impossible for them to even contemplate that he would go live in a dormitory, do his laundry only once a week, go to classrooms, sit in chairs that other people had sat in, sit next to other people. He had two OCD concerns. One was that he would get a germ or a virus or a bacteria and get sick. The other was specifically that he would throw up. So again, we conceptualize what is it you're afraid of, and then we go and do that. So he and I would sit around and say a bunch of vomit words, all the colorful slang, Ralphing, Technicolor yawn, throwing chunks, losing your lunch, tossing your cookies. We would sit around and tell each other stories, try and do the dozens, top each other about how we'd thrown up that morning, about our dry heaves. Then he would look at, there's a specific website that has photos and cartoons and progresses up to videos.
And what is the purpose of that? Is to not take it so seriously? Is to look at it, to kind of almost depersonalize it in a way?
Certainly to depersonalize it, to get it outside of you, to have some humor about it, to have some perspective about it. Certainly there was a lot of humor in him and me making up throw-up songs and telling up throw-up stories. And we made throw-up videos. We made videos where we were making vomit noises and pretending to vomit. I've done this with a lot of kids. There's humor in it, but there's bravery in it, because these are people who have been terrorized and bullied by the idea that they might throw up, and where life has become about not throwing up.
And it's very isolating to feel that way. Because it stops you from doing things, because you're saying, I'm not going to go to that place, because if I do, your whole world stops really when that happens. I mean, because it's such an upheaval to your body. And then everybody around you kind of gets repulsed, because that's a natural instinct, because it's a mess. So, I mean,
vomiting is a mess, but avoiding all of life in order to not vomit creates a bigger mess. A child who can't go away to college, a child who has trouble going to school, a child who's spending his day in decontamination rituals. This young man, when he would go to class, would come home, take off all his clothes and put them all in the wash. His family was accommodating this behavior by doing multiple loads of laundry each day. So what we had him and his parents do by agreement is gradually decrease the amount of laundry that was being done, gradually decrease the amount of support and accommodation that his family was providing.
And was this when he was in his home?
Yes.
Before he went to school? Okay.
Yes. So we did all this work while he was in his senior year of high school. He was able to completely eliminate the fear of throwing up concern. He was able to eliminate his decontamination procedures. He was able to ratchet it all down to a dull roar, so that he was able to apply to college and go away to college. And so that his life became about the happy, normal experiences of getting educated and being with peers, doing extracurricular activities and preparing yourself for a career rather than about avoiding throwing up and avoiding illness and giving up normal, healthy activities for his age.
And how long did that particular treatment take? I mean, it sounds like the parents were proactive insofar as they were starting to do things at home so that there would be this transition because they knew that he was not living at home, he was going to live in a dorm?
Yeah. I'm giving you a conglomerate of several different people, but when I think of one particular person, I'm thinking of two different young women where it went remarkably quickly, where it goes so quickly that I thought, how can this be? Am I making some kind of mistake? But yeah, it can take only a few months to get rid of contamination OCD completely. So I would do things like we would go touch the toilet, touch the garbage can, touch all the sinks, touch all the counters in my office suite, and then crawl on our bellies on the floor on a carpet that people have been treading on for a decade, 2 decades, and then without washing hands, prepare a nice wet snack and eat it together, even with a parent involved too. And it is often quite remarkable how quickly the published figures for obsessive-compulsive disorder are that doing this exposure therapy works for about 80% of people, with works being defined as the disorder's severity is reduced by over half. So that's pretty good.
That's amazing.
It's
certainly for the person going through it.
It is amazing. And certainly, so, 80% means 20% of people are not getting better, and a 50% reduction of severity means it's not gone completely and it's not cured. It's down to a dull roar, and
maybe more manageable. And in effect, is that not progress as well?
It's huge progress. If it's not interfering with your life, if it's not keeping you from doing normal activities, working and dating and moving on in the ways that young people are supposed to move on. We do this treatment with adults too. The idea is exposure. Face your fears. Do what you have been afraid of. Gradually, step by step, going up a ladder, going upstairs. Often parents have to set up sort of an incentive system. You want to give the kid big praise. You set up some sort of specific rewards, privileges, and daily encouragement and praise and incentives for doing whatever is your particular brave practice. The treatment for anxiety disorders, the cognitive behavior therapy treatment, is to conceptualize clearly what is dangerous, what is not too dangerous, what entails some risk but not an outrageous amount, and then to do those things that entail some risk but are worth it for the benefit. www.worcestercognitivebehaviortherapy.com, and through there you can access a lot of good resources for the treatment of anxiety disorders in children, teenagers, and adults.
I am Ramona, and thank you for watching Ramona Interviews. Have a wonderful week.